Hello friends, this is Sonu and today I am going to discuss about the ethanol, that is the ethyl alcohol. So first of all I would like to say that why the ethanol or ethyl alcohol discussing in the pharmacology. What is the main reason? First reason, that is it's a very clinical use. During the clinical use it's a very popular molecule, like for example during the surgery, on the during the surgery the disinfectant of the skin on the time we can use as an antiseptic solutions of the ethyl alcohol, and some other medical procedure. uh, about this clinical uses we'll discuss in a later. So right now just why the ethyl alcohol or ethanol discussing the pharmacology for the clinical uses. First, for the clinical uses. Second thing, as we know that alcohol is a very popular molecule and almost most probably person are drink the alcohol, and as we know also that it's a very bad for the health. Most probably it's a very bad for the health. So how it will be changed in the body, what organs will be the damage, how it's like we can say affected of the our body, and in what persons the alcohol should be avoided, and if the person will take too much alcohol, it means the acute intoxication of the alcohol, how will be the mileage, I mean the mileage of the persons who take the too much alcohol. About this all informations, for the all information to know, that's why the ethanol discussing the pharmacology. So first of all, what is the ethanol? According to the chemical structure, it's a hydroxy group. So it's a hydroxy derivative of the aliphatic hydrocarbon according to the chemical structure. Second, how will we the manufacture, or how will we make the ethanol? So ethanol will fermentation of the lot of substance, for example such as sugar, fruits, vegetables, grains, and so on. By this way we can make or we can manufacture the ethanol. By what form we can take the ethanol, like how will we get the ethanol, how will we drink the ethanol? First, it's a malted form like beer. Second, in a wines, the the amount of the ethanol is depend upon the wines. Like in some wines are 40%, some wines are 30%, 20%, depend upon the wines. Third, in a spirit form, it's very popular as an antiseptic, and like in a brandy, whiskey, rum, and vodka. By this, it's like a wines. So by this, like brandy, whiskey, rums, and vodka, the ethyl alcohol is there in this form. So by this form, we can get the, or we can take the ethanol by this way. Then, what is the main pharmacokinetic, that like the person or any person that take the ethanol or ethyl alcohol, how it will be act on the liver, what is the main enzyme or main reactions. So let's discuss about the main reactions or main molecular reactions in a liver. But before the start the liver, first we should know what is the main route of administration. First, it's orally, most probably orally. Second, inhalational form in some cases, inhalational. By the topical form, topically, like applying the skin and other medical procedure. Then by the injection form, like intramuscular and subcutaneous tissue. By this form we can take or we can administer the ethanol or ethyl alcohol. Now in a liver, ethanol. Ethanol become acetaldehyde. By the help of alcohol dehydrogenase. So ethanol by the help of acetaldehyde enzyme, that is the acetaldehyde, and then acetaldehyde by the help of aldehyde dehydrogenase, it become acetic acid plus CO2 and H2O, that is water. Again, whenever any person take the ethanol, it go in a liver, and in a liver, ethanol by the alcohol dehydrogenase enzyme is present on the liver, it become acetaldehyde, and the acetaldehyde by the help of aldehyde dehydrogenase enzyme, it become acetic acid plus CO2 and the H2O, and then acetic acid will further go in acetyl CoA, and then acetyl CoA will fatty acid, and then fatty acid by the triglycerol, the reaction will go move. The all functions will go move. We'll not discuss here the biochemistry. Just you have to know that ethanol by the acetaldehyde will ethanol become acetaldehyde, acetal become acetic acid, and then acetic acid further acetyl CoA, and then acetyl CoA become fatty acid. It means here you can think that if you too much taking the alcohol, it means it's eventually lead to the increase the fatty acid. If too much ethanol will taking the persons, here the fatty acid become, the concentration of the fatty acid in a liver become high. It means that if you prolonged use or if you chronic use the alcohol, your liver become fatty, so it's a fatty liver. And as we know that the fatty liver is very danger, it can damage the hepatocyte and it can be create the inflammation, and the further problem can be created. That's why these reactions you should know, then you can understand that how will be the liver is damaged, what is the main reason to damage the liver. This is the main reason, that if you too much ethanol is taking, your fatty acid, your liver become too much fat or accumulation in the liver, and liver become too much fat, so we can say fatty liver. So this is the main we can say pharmacokinetic that you should know. Now we'll discuss what is the main pharmacodynamic or pharmacological effect that the person take the ethanol, how it will be effect in the body, individually, like in a CNS, in a heart, and in other organ. So let's discuss pharmacological effect. First, let's start from the local action. Local action means like a skin and mucous membrane, like in a skin. If you apply in a skin, in a normal skin, it will be some like sensation can be feel, but if you apply in a, like the cutting skin or like the flashing of the skin, on the time it's too much burning, so we can say during the cut, like a skin become, so cuts the skin, very burning, and pain can also, even patient can't tolerate if you apply in a cuts skin or if you scratch the skin by the nails or during the accident, on the time if you apply, it's too much burn, even patient can't tolerate. But if in a normal skin if you apply, so some sensation can be feel. And in a mucous membrane, for example in a mouth, if you apply in a mouth, so it's depend upon the concentration. If you like the higher concentration, if you apply in a mouth, so it can be very severe condition can be developed, like necrosis can be developed. So in a high concentration, necrosis can be occur. And if you apply like in a injection form, if you inject in a particular area like in a muscles or in a subcutaneous tissue, so it's a completely it can be completely paralyzed or completely irreversible actions. It will not automatically in normal condition. So it permanently damage can be, the nerve can be permanently damaged. So it can damage nerve permanently. Permanently can be damaged the nerve. That's why we should very carefully have to give the any persons or any patients, the amount should be very normal, not it's too very concentrated, because if it's a concentrated amount, if you apply in a mouth, like for example in some conditions, by the gargling form, by like in a gargling form, use the ethanol or ethyl alcohol. So on the time if the concentration becomes too much, so necrosis can be occur, means like the burning sensation in the mouth mucous membrane, and it can lead to the necrosis, and then inflammation can be there. That's why on the time very carefully have to take the patients or the persons. So in a local actions, this types of effect you can see. Now we'll discuss what could be changed in the CNS, central nervous system. Even in central nervous system, about all are know that if any persons take the alcohol, how they will react. CNS. In a CNS, lot of effect you can see, such as euphoria, lack of alertness, the we can say disturbance of speaking, speak. Even the person can't stand, can't talk to properly, even can't move. Very bad behavior, and hallucinations type effect can be seen in a persons. So mainly these types of effect you can see in a CNS. And one thing also, that if you very high concentration of ethanol can be take the patient or can be take the person, it can paralyze the medullary area, means the paralysis of medulla, means medulla oblongata, this is the main center of the brain. So if the paralysis of the medulla, it means the persons can be go in a coma, and sometimes the person can be die due to the paralysis of the medulla. So the chronic alcoholism, or we can say the suddenly intoxication, or if the person will take the too much alcohol and the concentration becomes too much high, so on the time the medulla can be paralyzed and patient can be go coma and can be die. So this is effect on the CNS. What could be effect on the CVS, cardiovascular system? CVS. In a normal amount of the ethyl alcohol will not any effect can be seen as CVS, but in a moderate amount In a moderate amount can we see tachycardia, the increased sympathetic stimulation, the muscles contraction, increase, but in a moderate amount. But if the patient take high amount, and as I discussed in a in a CNS cases, central nervous system, that the concentration if become high, it means it can paralyze the medullary area. And as we know that the lot of center in a medulla oblongata, so if to suppress the medulla oblongata means the all center become suppressed. So in this case the blood pressure become down. Why? Due to the suppression of the medullary area, and the patient can die also due to the bradycardia and suddenly cardiac arrest due to the high amount, and the medulla become paralyzed. So this effect can be seen in a cardiovascular system or in a heart. Now we'll see what could be effect on the blood. In a blood, we can see it's a good effect in a blood. Like in a normal amount, for example, the 1 and 2 ml a day. If you using this amount of the ethyl alcohol, so HDL level, that is the good cholesterol, high density lipoprotein, are seen that it's high, and LDL level, that is the bad cholesterol, this is the low. So these effects are seen on those persons who taking everyday alcohol 1 to 2 ml a day. It's a very minimum, or we can say very normal amount of the alcohol. So if you this amount of alcohol you if the person is take, this can be effect are seen. Increase the HDL and decrease the LDL. It means for the coronary heart disease, coronary artery disease, we can say coronary artery disease, it's a useful for this patient, because as we know that HDL is the take the fat from the peripheral area and it's transport in the liver. That's why we can say that it's a good for the coronary artery disease. In blood, in others organs, like in a respiratory, it can be collapse. Why? Due to irritation of the pharynx and larynx, muscles. So on those time can be collapse, and due to asphyxia it can lead to very dangerous, and even patient can die. I mean the person can die. So collapse can be in a respiratory. What would be changed in GIT, gastrointestinal tract? In a GIT, like in a normal dose or in a moderate dose, it's a very high acidity. They increase the HCl production. We can say hyper acidity. Increase the amount of HCl, hydrochloride acid. But in a high dosage, it's decrease the acid production. Means in a normal or moderate doses are seen that increase the acid production, but in a high doses decrease the acid production. So in a chronic alcoholism patient, or in a chronic alcoholic who is using very prolonged time, can we see that gastritis can be occur, or can be peptic ulcer can be occur. So we discuss CNS, we discuss CVS, respiratory, we discuss blood, GIT, Now we'll discuss that in a kidney, what could be changed in the kidney. Kidney. In kidney can we see diuresis can be occurred. Diuresis. Why? Because the ethyl alcohol or ethanol, it's suppress the ADH. Suppress the ADH, that is antidiuretic hormone. And as we know that antidiuretic hormone, the main function of the antidiuretic hormone is absorb the water in a kidney. It means if you suppress the ADH, means the water will not absorb. That's why diuresis can be occur, or we can say the polyuria. More correctly, diuresis due to the suppress the ADH. So this effect you can see in a kidney. Another organs, like what could be changed in a sexual activity. Sex. Any person who taking the ethanol, so very aggressive sexual behavior we can say. Aggressive sexual behavior. Very aggressive sexual behavior you can see, but the performance of the sex, it's low. Performance of sex is very less. In some time, even mostly who the chronic uses, I mean the prolonged uses, impotence can be there. Impotence can be there, and gynecomastia, the atrophy in a testis, atrophy in testis, infertility, can be seen. So this is the very huge effect on a sexual activity can be seen. In endocrine, what could be changed in the endocrine? First, it's increase the adrenergic activity. Second, mostly it's increase the adrenergic activity. Due to this reason, the increase the sympathetic stimulation, means the catecholamine, that is the epinephrine, norepinephrine, the concentration of the catecholamine is increased. Due to this reason, the whatever the function of the catecholamine are increased. For example, the heart activity, the contraction of the muscles become high, the persons become too much aggressive, like that can be seen in endocrine, like if the changing in the endocrine functions. So this is the main effect, or we can say this is the main pharmacological effect whenever the persons will take the ethyl alcohol. This effect we can see in a persons who take the ethyl alcohol. So about the next, we have to discuss the clinical usage. What is the main, like the normal amount of the alcohol that should to take the patient, the persons, or in acute intoxications, what we have to do to the persons who take the alcohol, how will be the manage on the time, and what could be the contraindications. About this thing we'll discuss in the next session. In this session we discuss the main mechanism, main the pharmacokinetic, main the pharmacological effect. So hope you will understand about this. In the next session we'll complete the all about the ethanol. Thank you.